Hi everyone, my name is Mrs Williams. I teach health and social care at Litherland High School. I just wanted to start off by putting some of the more popular jobs on the board for you. These are some that children already come into the lesson thinking, I want to be this, and this is a great course for these jobs that you can see. There are over 200 jobs in health and social care, so some of them they might not even have heard of before, and hopefully what this course will do is it'll introduce them into different types of jobs, and it'll give them a range of skills that they need to be able to work within the health and social care sector as well. So I just thought I'd give you a little bit of information about the health and social care sector. There's about 3 million people that work within the sector in the UK. The roles range from doctors to pharmacists to healthcare assistants, also nursery nurses, childminders. They account for nearly 1 in 10 of all paid jobs in the UK. Now, the demand for health and social care jobs at present is likely to rise, and that's because of the pandemic. So it would be a really good course and a really good career path for youngsters to get involved with. It's a really nice course for them to do, and I'll tell you a little bit more about it as we go through. Okay, so the course is a BTEC level 1 and 2 in health and social care, and it's 60% coursework and 40% examination. Now this is a really good course to choose if you are not very confident with exams. We do the coursework from the start of year 10, and hopefully the coursework will be finished by Christmas in year 11. Then we focus on the exam from Christmas until summer. I've put a little table on there just to show you how the grading is different to GCSE. So GCSE, the grading system goes from 1 to 8 or 1 to 9. In BTEC, it goes from a level 1 pass to a level 2 distinction star. I've tried to put them next to the GCSE grades so that you can see how they equivalate. Now, in Litherland High School, health and social care has been really successful. Most of our students have gone on to study it after school, whether that be through apprenticeships or at college. We've had some last year take it as an A-level. The course itself is classed as a level 1 and 2, and basically, depending on what grade they get, depends on where they can go after school if they wanted to continue their studies. So, if they got a level 1, they could go to study level 2 at college. So some of the stuff they do at college, they might have already done in school, and this is just because they didn't get the higher grades. So it's kind of like they recap it and they try and get that higher grade. If they get a level 2, it leads into more options for them. So they can do it as A-levels, and that can lead into university. They can do level 3 at college. So if you haven't studied health and social care in school, you'd start at level 2, whereas if you get a level 2 in school, you can go to do a level 3. There's also a range of apprenticeships available within the health and social care sector, and they tend to be a lot more specific. So they wouldn't be called health and social care. It might be nursery nurse, it might be nursing, and they are very specific. So if you study health and social care at Litherland High School, there are a range of colleges and sixth forms within the area that go on to run level 2, level 3 courses. There's quite a few apprenticeships around in the area as well, which is really good, and there are also a lot of sixth forms that run A-level health and social care. So what I've done for you on this slide is just to show you some pathways that you could choose to do after school. I've chosen Hubert College. You can see at the top it says level 2. So if you achieved a level 1 in school, the 2 courses at the top are what you could go on to study at Hubert College. The level 3s are what you would go on to study if you had achieved a level 2. Now this is just a really quick search on the Hubert College website. If you've got a more specific career in mind, there are lots more different courses you can choose, but these are just some of them that the health and social care course can lead on to. Okay, so I'm going to talk a little bit about the course now, and the first thing that I'm going to start off with is just how the coursework will be marked, which sounds like a little bit of a weird place to start, but what I want to get across to you is, if you are a hard worker and if you want to do well in this course, that is completely down to you. Okay, At the start of every piece of coursework, you will get this table that you can see at the bottom of the screen, and you can see that it's got level 1 pass, level 1 merit, level 2 pass, level 2 merit, and level 2 distinction. If you wanted to get a level 2 distinction, you would have to make sure that every single box in that table is ticked and you've done the work for that. Now, when you first start, it might look really daunting, but once we break it down and we do class lessons about each area, it's very, very easy to do. So if you are determined to get a career in health and social care, this is a course where I personally don't feel that you can fail. I don't think we've had anybody get less than a level 2 pass in the last 2 years at the school, and that's because the girls tend to be really into it. They love the coursework, they love having a go at it, and they're willing to work really, really hard. Okay, so this is how the coursework is marked. At the top you can see it says points available for internal components. They do 4 pieces of coursework, and for each piece of coursework I will give them a grade. So if I say they've got a level 1 merit, that will mean that they have 15 points for that piece of work. Now what we want to do by the end of it is we want to meet certain barriers. Because we know what the numbers are, I can try and push pupils to make sure that they get the grade that they really, really want to. Points available for the external components. This is the exam. So the children do it in school. It's a 2-hour exam, and the papers get sent off and marked, and we get their marks back. So we don't really have a say in that, but if their coursework is really, really good, they can still get a good grade overall. Okay, so this table at the top just shows you how many points are needed for each level. And as I said before, once all the coursework's completed, I can tell the children how many marks they've got, and then we can roughly work out how well they need to do on the exam to get certain grades. And I will always push them to achieve the top grade if possible. Underneath here you can just see some examples of how the marks are calculated. So the first table, this person has got a merit for the first unit of work and a distinction for the second, and on the exam they've got a level 2 merit. So when we add it up, they get 101 marks, which means they get a level 2 merit overall. The example where it says example 3, unfortunately, if you get a U in any unit of work on this course, it does mean that you get a U overall. So it's really important that if you're absent for a piece of coursework, that you try and catch up and you get it done. But as I said, we've never had a situation like that before. Okay, so I'm going to talk about the content of the course. It's 3 units that we're going to complete over 2 years. As I said, 1 exam and 4 pieces of coursework. So Unit 1A is all about life stages, Unit 1B is about life events, and both of those coursework marks will be combined together to get the overall mark. Then we've got Unit 2A, which is about care services, Unit 2B, which is about care values, and then we've got our Unit 3, which is about healthy living, and that is the external examination. Okay, so Unit 1 will investigate how in real life situations human development is affected. And what we do with this unit of work is we look at how people's lives can affect them at that time and later on in their lives, and we also look how different life events can affect people as well. It's 2 pieces of coursework that the children really like and they like to get involved with as well. They get to do some interviewing, they get to do a lot of research skills, and they get to actually do their coursework about people that they're interested in or people that they know. So Unit 1A is called Life Stages, and we look at the 6 life stages that we will go through in a typical lifetime, and we'll study each one. We'll have a look at what things can affect different individuals within those life stages, and for the piece of coursework the children have to choose either a celebrity of their choice or somebody within their family that they can write about. Now I've just put a picture of Meghan Markle on the screen there because at present she is in the news all the time. There would be lots and lots of things that we could write about that could be affecting Meghan Markle at present, and there are lots of things that have happened to her in her childhood that we can write about as well. So for this piece of coursework, they need to choose somebody who they can find lots of research on, and we do all the research before we start the piece of coursework, so that if it's a person who there's not much on, we can change it so that the children definitely have enough to get that top grade if they wish to go for it. So the second piece of coursework for Unit 1 is called Life Events, and basically we look at different life events that can happen to individuals throughout their lifetime. We have expected life events, which people expect to happen. People might expect to get a job, do the GCSEs, they might expect to get married or have a baby. And there's also unexpected life events, so things like divorce, an accident, an illness, maybe being made redundant. And we have a little look at how all of those events can affect people of different ages, people who are brought up in different ways. And then what we have to do for the coursework is we have to choose two people that have been through the same event. So for example, I've put divorce on the screen, I've picked two people, and on the left hand side there are some things that could have happened to one of them. These tend to be quite positive. And then on the right, I've wrote about some negative ones. Now, it doesn't have to be that the two people they choose have completely different experiences. We just want to show the examiner that you can interview a person, you can gain information, and you can assess how it could affect them now and how it could affect them in the future. The children love this piece of coursework because they tend to choose family members or friends that they know and that they can ask these questions to. If you're thinking, I've not got anybody to choose and it might be putting you off doing the course, don't worry, because there are a number of case studies where I have found two people who've gone through the same thing, and I can help you get the information that you need. So please don't be worrying if you're a little bit unsure of what you could do for this coursework. So Unit 2 is all about health and social care services, and also values that they would need to know if they worked in the health and social care sector. This unit for me is the best one to introduce new jobs that they might not have heard of within the health and social care sector. We look at a range of them, and we also look at how different jobs all work together. So they might have an idea of, oh, I want to be a nurse, but as we do this course, they might actually get to understand what types of nurses there are, who nurses work with, and it's just really interesting for the children. Oops. Okay, so for Unit 2A, what we're going to look at is we're going to look at a range of different services. So we look at primary services such as doctors, A&E, opticians, dentists. Then we look at secondary services, which are more specialists, so cardiologists, respiratory specialists, and we also look at tertiary services as well, such as physiotherapists, speech and language therapists. There's a whole range of jobs that some of the children may never heard of before. Once we've looked at all of these jobs and what they include, the children will be given a case study about two people, and the people within the case study have a range of different needs. So they might have asthma, they might have skin conditions, they might have speech impairments, and what they would have to do is select the best service for them to get treatment off, and they would have to write down what this service could offer them, how would they treat them, how would they either cure or look after them. It's really good, it's really interesting. Hopefully by the time they come to do this piece of coursework, we will be allowed visitors in school, and I'm looking to get midwives in, physiotherapists in, just to talk about their jobs and give a more specific insight into what they do. So Unit 2B is all about care values. In order to work in the health and social care sector, there are 7 values that you need to be able to demonstrate. They're the ones that are listed below. So independence and empowerment, dignity, safeguarding, confidentiality, effective communication, anti-discriminatory practice, and respect for the individuals. Now for this piece of coursework, we look at each value in detail, and we try to get lots of examples so that children understand how to demonstrate it. They also look at what can happen if people who are working in the health and social care sector don't demonstrate these values. And what we do for this unit of work, there's a range of ways we can do it actually. We can role play, so we might have someone who's being a nurse and someone who's the patient, and the nurse has to show me that they can demonstrate these 7 factors. We have done it before where the class have taught year 7 in more of a youth setting. So some of them have talked about healthy eating, some of them have talked about getting fit, and they've actually made, for example, smoothies with them, or fruit kebabs, or they've done a little fitness routine with them. We're also thinking of allowing the class to work with the year 5 and 6 on transition days, just as it's something different and it'll be exciting for the year 5 and 6 children as well. And a few years ago we helped with the Rowan Park Sports Day as well, which gives the children a chance to take the lead in Sports Day. They get to run different events, and they also get to work with other teachers from other schools and other children as well. Okay, so Unit 3 is the exam. It's split into 4 main sections and it's worth 60 marks. The first section is analysing circumstances, and on the next slide I have put a question linked to this section of the exam so that you can see what I'm talking about. Health testing, we're going to focus on 4 different health tests. So we've got blood pressure, BMI, peak flow and heart rate. The children are going to learn how to take all of these tests. They're going to be able to analyse the results, and they're hopefully going to be able to tell us what symptoms a person might have if, for example, their blood pressure is high. Then we've got health improvement plan. Based on the information about the individual in the exam, they have to come up with a plan that is going to improve that person's health and well-being. Now, a lot of this plan is going to be linked to the health testing. So if we said somebody's got high blood pressure, what can we do to try and improve that? A lot of it is linked to the images that you can see, so smoking, drugs, alcohol, diet and exercise. The last section of the exam is obstacles and barriers, and this section looks at what could stop the individual from carrying out your improvement plan. Now, the exam is a really nice exam to study for. The 4 sections within the exam we revise over and over again, and we also revise the layout of the answers, so how to answer the questions correctly. So this is part of an exam. This is what they will get at the very start. This is all the information on the individual that their exam is going to be about. So it's got location, medical history, family, friends and social interactions, and day-to-day life. And just to give you an example of what some of the questions would be like on section 1 of the exam, I've put them there. So the GP surgery has asked you to review the information about Jacob, explain 2 lifestyle factors that could have a negative effect on Jacob's health and well-being. All the children would have to know is what lifestyle factors are and what health and well-being is, and basically choose things out of that passage that are causing him to have a negative lifestyle. So it is a nice simple exam to do.